This is Radio Health Journal. I'm Reed Pence. This week, tough-to-treat cases of fungal sinusitis.
I actually had a sinus infection that lasted 25 years, and I had 4 surgeries, and I calculated over 100 courses of antibiotics in those 25 years.
Sinusitis where bacteria's not to blame, when Radio Health Journal returns.
People with more formal education and jobs requiring complex thinking may better withstand Alzheimer's disease. New research reported at the 2016 Alzheimer's Association International Conference suggests that lifelong mental stimulation builds up what's known as cognitive reserve, providing resilience against the onset of Alzheimer's. Dr. Maria Carrillo is Chief Science Officer at the Alzheimer's Association.
It's becoming increasingly clear that both lifestyle and medication will be important in treating and ultimately preventing Alzheimer's disease. These new studies add to the growing evidence that lifestyle factors can help build resilience against memory decline and dementia. They show that formal education and complex work may provide some protection even from risk factors such as an unhealthy diet or blood vessel problems in the brain.
The new study suggests that work with people rather than data or physical things is likely responsible for the protective effect of a complex occupation. Find out more at alz.org.
Erin Porter of Tampa, Florida, had been having sinus problems since she was in her early 20s. It took until she was in her mid-40s to find out what was wrong.
I actually had a sinus infection that lasted 25 years, and I had 4 surgeries, and I calculated over 100 courses of antibiotics in those 25 years, and I had chronic, both bacterial and fungal infections. Later, I was diagnosed with aspergillomas is actually what they're called, and they're fungal balls in the sinuses, and I had several. And I would go to an ear, nose, and throat about every 2 to 4 weeks in between all these surgeries to get them removed, only for them to grow back in the matter of days. So it was an uphill battle. The antibiotics stopped working. I was on even the big guns of antibiotics, the vancomycins and the tobramycins, and started to become resistant to some, and my future was starting to look pretty bleak.
Most people think of bacteria when they have sinusitis. Most doctors do too, at least at first. And antibiotics are the treatment of choice. But if a person's sinuses are infected with fungi, antibiotics will do nothing and may even make the problem worse.
Well, it removes the bacteria from the lining, and bacteria tend to compete with fungi for food in the environment. So if you remove all the bacteria, then the fungus have free range to grow.
But Dr. Donald Dennis, an ear, nose, and throat surgeon in Atlanta who treated Erin, says that won't happen to most people. Virtually all of us have fungi in our nose and sinuses, and they don't affect most people at all.
There are people who can be in extreme toxic environments with fungal loads that would literally kill other people, and they don't get sick.
That's the thing that's kind of amazing, right? So if people have fungus in the nose, and you may not have any kind of reaction to it, and you may not have any problems. So if you're not allergic to these certain types of fungus, you don't have any reaction. There's nothing that happens.
Dr. Joseph Hahn is professor of otolaryngology, head and neck surgery at Eastern Virginia Medical School.
Top layers of the respiratory mucosa have hair cells, and those push things out. And they push it out of the sinuses, they push it back into the back of the throat, and you just kind of get rid of it. So you blow it out or you drain the back of your throat, and then it's gone.
However, people like Erin, who are allergic to fungi, may have severe problems that go on and on.
About 10% of the population has a severe susceptibility to mold, and there's about 31 million people in America who have chronic sinusitis. And what they're finding is those people are the ones that their immune system just overreact to mold. So one person can be fine working in a building, or one person can be very healthy in the family, while the other one is not.
People like Erin have an immune issue where they have a genetic defect in their T cell, which is a white cell that attacks the fungus. But in them, they react 9,000 times normal, rather than a normal person will just react with 0.01% of their T cells, whereas people who have chronic sinusitis react with 3,000 of their T cells. and each one of those 3,000 secretes 3 inflammatory chemicals. So then you have 3 times 3,000, so that's where the 9,000 times inflammation comes from per mold spore. So they don't need many mold spores to make them sick.
Dennis says he believes fungal sinusitis infections are increasing, or at least they're being diagnosed more often. There's much more awareness of them these days, especially, according to Hahn, in the humid south and southeast.
Fungus is ubiquitous. It's everywhere. But in the south, where it's more humid, it tends to be in the air more commonly. It gets inhaled through the nose. And then a few of the sinuses get trapped in the sinus cavity. Now, if you take a culture of everyone's nose, whether they're healthy or not healthy, almost everyone will have fungus in their nose. But not everybody has an allergic reaction. Only people who have allergies to fungus, what happens is when these fungus get trapped in the sinuses, your body develops an allergic reaction to it, and it recruits cells like eosinophils, and it starts to grow. And it grows like a tumor in the sense that, once it starts recruiting itself and more of it comes in, and it just kind of is a self-perpetuating disease.
That immune reaction damages the lining and damages the cilia, which are the little hair cells that move the mucus out. It makes a small pit in the lining so that the mucus doesn't drain out. And then they get a secondary bacterial infection. But when you just treat that, it tends to recur because the fungus is still there, so you got to address the fungus.
There are a variety of kinds of fungal sinusitis. The allergic form can make life miserable, but Hahn says what are called acute and chronic invasive forms can be life-threatening.
For the chronic, it tends to be very slow-growing, indolent, usually in patients who can be a little bit immunocompromised, meaning their immune system is not as strong. It's usually commonly seen among diabetic patients. And acute invasive are definitely patients who are really immunocompromised. So these are patients with organ transplants, people who have leukemia and are undergoing treatment for that. They just have no way of fighting off the fungus. And in these situations, the mortality can be high as 50%. They have little symptoms such as a little bit of nasal congestion, and that's all they may have. But when you look inside their nose, the fungus is basically eating the patient alive. And what it's doing is invading the blood vessel and is causing necrosis to occur. And once that fungus spreads, and it spreads along the blood vessels, once it spreads into the brain, the chance of dying is very, very high.
Hahn says it takes a good ear, nose, and throat doctor to treat these kinds of infections.
These are emergencies. You see them as soon as you can. You can't wait 2 weeks to see them. You try to see them as soon as possible. And when you see these patients, what you do is you take a look inside the nose. And one of the first things I look for is whether or not they can feel, because when you push an endoscope, which is a long camera, and you touch the nasal cavities, they should be able to feel it. These patients don't feel it because the fungus goes into the blood vessels. The blood vessels no longer supply blood to the nerves and the tissue. The nerves die, and they can't feel things. And then because the blood supply is now gone, that's when the tissue becomes necrotic. And the only way to diagnose somebody with invasive fungal sinusitis is you have to get a biopsy.
Fungus may go anywhere in the body, but it generally stays close to the sinuses, in the eye and brain. Hahn says treatment is extremely difficult.
You have to be very diligent because you have to go in there and try to remove as much of the fungus as possible. You also give them antifungal treatment as well. And in patients who are immunocompromised, you try to revert their immunocompromised status. So in patients who have leukemia and are getting chemotherapy to get rid of their leukemia or the blood cell cancers, when you're trying to use chemotherapy to treat the leukemia, sometimes you'll have to stop the leukemia so that you can get the cells that fight off these fungus to grow back. And that's probably the best prognosis, is that the leukocytes, which fight off the fungus, comes back.
Yet another form of fungal sinusitis is not invasive, but Hahn says mycetomas can sometimes be serious.
Those are things that are relatively benign, other than when it gets really large and starts pressing into the eye or the brain. These fungus kind of grows, the eosinophils kind of dead, kind of grows and eventually dies off, and then you have fungus mixed in with dead eosinophils. These dead eosinophils become crystals called charcoal-laden crystals. After it grows to a certain size, if it needs to grow more, it remodels the bone and pushes into the eye, it pushes into the brain, and you can get what we call proptosis, meaning the eye starts sticking out. Medical treatment doesn't cure these patients.
Medicines can alleviate pressure and swelling, but Han says only sinus surgery can remove the fungus in those serious cases and begin to stop the cycle. However, treatment doesn't stop there.
A lot of people think that by doing surgery, you kind of cure the problem, but it hasn't, because you're still allergic to fungus, and fungus still is in the air. So once it goes to the sinuses, it can grow again. So you got to do sinus surgery plus medical treatment afterwards to prevent the fungus from coming back and the polyps from coming back.
The reason they recur is because the immune reaction continues, mainly because they're getting exposure in the environmental air. If you don't address the fungal load in the air and in the body, you don't get a long-term result. As it turns out, the air you breathe is 5x more important to your health than any other treatment.
That was the case with Erin Porter and her allergic fungal sinusitis. Her initial treatment with another doctor was partially successful.
He took one look at the CAT scan and said, "You have a severe fungal infection." I started on the antifungals, and I watched my world transform. My sinuses got about 50% better. You have to take it out of your sinuses, but you also have to address your air, and that's another thing I wasn't doing. If people are living in a moldy environment or working maybe in a sick building or a moldy building, it's going to come right back.
Dennis says HEPA air filtration, getting rid of carpets, and using antifungals on laundry help address mold exposure. But how do you know if your chronic sinus infections are fungal in the first place?
If they're having 4 or 5 sinus infections a year, they're treated with antibiotics and they're recurring, or they're getting it for 3 or 4 weeks at a time and having trouble with it resolving and then coming back, those all have chronic sinusitis. It's bacterial and fungal. The bacteria are the infection that's apparent, and the fungal part is usually more stealth, although it can be visible endoscopically in the nose. In a certain number of cases, you can actually see the fungus in there. But in a lot of them, you don't see the fungus, but you can culture it out.
One well-known study at the Mayo Clinic found fungal involvement in more than 90% of sinus infections. But Han isn't sure that that's the complete picture.
If you look at that study, they say like 96% of patients with chronic sinusitis have fungus. But if you look at the control, 100% of them had it. So both the study group and the control group both have fungus.
The picture is confusing. That's why an otolaryngologist or ear, nose, and throat specialist is often a good check on recurrent sinus infections that don't respond to antibiotics. You can find out more about all of our guests on our website, radiohealthjournal.net. You can also find archives of our programs there and on iTunes and Stitcher. I'm Reed Pence.
Radio Health Journal returns with medical notes in just a moment.
Medicare and their list of suppliers continue to change. So if you have diabetes, it may affect where you get your testing supplies. But rest assured that your number one doctor-recommended one-touch testing supplies are always covered by Medicare Part B at your local pharmacy and select mail-order suppliers. Dr. Brian Levy, Chief Medical Officer at LifeScan, maker of one-touch products.
Some mail-order suppliers may offer a limited selection of diabetes testing supplies. They may try to switch you to a different brand, saying your current products are no longer covered. That's just not true. You are entitled to continue using the products you know and trust and that have been recommended by your healthcare professional at no additional cost.
Remember, you have a choice. Stay with the number one brand used by Medicare patients. For questions about coverage or where to get your one-touch testing supplies, call 1-844-942-2654 or visit www.onetouch.com/Medicare. Medicare Part B is not a guarantee of coverage and payment, which may be subject to coinsurance, deductible, and patient eligibility requirements.
Medical notes this week. More couples are having children without getting married, and a new study shows that income inequality and the lack of good jobs are big reasons why. The study in the American Sociological Review finds that areas with a shortage of middle-income jobs have a higher proportion of young men who don't see themselves as good marriage material. And their partners agree. They're much more likely to live together and have kids without getting married. Chronic fatigue syndrome is a mystery illness that some people say is all in a person's head. But a new study provides evidence that it's for real. The study in the journal Microbiome finds biological markers in gut bacteria among people with chronic fatigue. Researchers are still exploring if the gut virus causes or contributes to the disease. They hope the findings lead to reliable ways to detect chronic fatigue syndrome in the future. And finally, preschoolers who are regularly tucked into bed by 8 p.m. are much less likely to become obese later in life than those who have later bedtimes. The study in the Journal of Pediatrics shows that bedtimes after 9 o'clock double the chances of obesity later in life. Previous research has linked shorter sleep time to obesity as well. And that's Medical Notes this week. More in a moment.
More than 80 million Americans bicycle for fun, exercise, and transportation, yet more than 1.3 million of them are injured each year. Orthopedic surgeons say broken collarbones and wrists are among the most common injuries, but sometimes even deaths result from a bicycle crash. But Dr. Stephen Olson of the Orthopedic Trauma Association says that both riders and drivers have a responsibility to share the road to help minimize injury.
Drivers don't always see cyclists, so be aware of your surroundings. Avoid distracted cycling with loud music and headphones, talking on your phone, or looking down at a handheld device. Choose your cycling routes wisely and avoid high-traffic roads. Take wide streets with slower cars and always supervise younger riders. Ride defensively and follow the rules of the road. And always wear an approved helmet. That reduces your risk of serious head and brain injury by 85%.
Bike riders aren't always in the right, but they're always fragile. Find out more safety tips at orthoinfo.org/bike safety. That's orthoinfo.org/bike safety.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.